Millions of Americans can soon receive a third shot of the coronavirus. Tonight, the CDC endorsed booster shots for vulnerable Americans.
The Delta variant, the vaccine is wearing off for certain people, and we are at high risk for becoming infected.
A CDC advisory panel voted on the booster shots today, and within the last hour, Director Rochelle Walensky signed off on that recommendation. Good evening, everyone. I'm Julie Hayner.
And I'm Alex Savage, in tonight for Frank Somerville. Walensky's approval differs, though, from the CDC advisory panel's recommendation in one big way. KTVU's Jana Katsuyama joining us live tonight with the details. Jana?
Alex and Julie, this afternoon, the CDC panel said healthcare and other frontline workers should not be offered a booster, and that contradicted the FDA's authorization yesterday. Well, tonight, Dr. Walensky said that she wants to align with the FDA, and she put frontline workers back on the booster list. The CDC's advisory panel said data showing waning protection among older adults prompted their decision. On Thursday, the panel said the Pfizer booster should be made available for people 65 and older, people in nursing homes, and those 18 to 64 with health problems that put them at high risk for COVID-19. In California, about 6.5 million people are 65 or older, and the state's health secretary says they're prepared to start boosters once the CDC guidelines come out for the 18 to 64 high-risk group.
We could see roughly 170 to anywhere up to 250,000 Californians in these different categories coming forward to get that additional shot.
There's some details that we still need to understand. For example, who are the high-risk people that will actually qualify to get that booster.
Dr. Michael Stacy, Chief Medical Officer for Lifelong Medical Care Community Clinics, says once the CDC issues guidelines, they'll be ready to give out doses.
I think it's really great.
Some say they want a third dose as soon as possible.
I really want to do it. I'm around children, my grandchildren.
I'm a kidney transplant, so all those little things affect on that situation.
Yuri Guevara of Richmond says he's a COVID survivor and urges people to get vaccinated.
We need to take it. Like I say, I went through. Thank God I'm alive. You know, like I said, I was very close to the death.
The CDC director and other health officials say the most important factor is reaching the 71 million unvaccinated Americans.
As we operationalize a plan to provide booster doses to Americans, we remain committed to continuing our robust efforts to vaccinate as many people as possible.
Even as we roll out boosters, I want to make sure that we're still prioritizing those individuals who have not gotten vaccinated.
And right now, only 55% of the U.S. population has been vaccinated. As for the boosters, the Pfizer booster is being recommended only for people who got their second Pfizer dose more than 6 months ago. And health experts are saying that Pfizer's booster probably will not be given to people who receive Moderna, Johnson & Johnson, or other COVID vaccines. Moderna and Johnson & Johnson are expected, Alex, to apply soon for their own booster authorization.
A big decision tonight. Jana, thank you for the details there.